This is after the surgery, and what somebody suggested, you have to tell the complications, otherwise even if it is 1 to 2%, they are going to bang on your head. So what Mr. Basu did, he is now very angry. He says that I never told him that an infection could require the removal of the implant. He said, okay, you do the surgery, I agreed for the surgery, you did you did the debridement, I went for the surgery, you do 2 or 3 surgeries, but you never told me that infection means the removal of the implant. And he tells you that he never would have considered the operation if he had known that this would happen. He has lost faith in me and tells me that he is leaving the hospital and going to see me in the court. And this is somehow a real story. These things happens with us also. Maybe the percentage is only 1 or 2, but they are bound to happen if you don't tell them. So the question is, can any patient be fully informed and gain a complete understanding? This is very much headache for us. It's written everywhere, you have to inform the patient, whether they can understand or not. So there are 2 things which always I agree. In this case, what I discussed earlier, should the orthopedic surgeon inform the patient if he does not think the procedure is indicated or reasonable? Or then we should inform, and in which way? I was not supposed agreeing to do the total hip arthroplasty because the patient was doing his job very well. Only he wanted to run or he wanted to play the tennis, and that was not the indication, even though I did. And should the orthopedic surgeon refer the patient for an alternative opinion? These 2 things, if we can adopt any point of time, that may also act as a legal document. If you had somewhere mentioned whatever you were thinking, you should not operate this patient, or after that you can take the advice or second opinion. Always take a second opinion. Even maybe your friend or maybe your enemy, it doesn't matter, but always take a second opinion whenever you are in doubt, and that is also act as a legal document. So what are the recommendations? After this boring lecture, include all the complications that may have a significant effect on the outcome and explain what treatment may be necessary. Try to avoid being told that I didn't understand. Patient usually says, Doctor, oh, मैं बांग्ला बोल रहा था कि आपने जो बोला था वो तो हमने साइंस से किया था, मेरे तो समझ में आया नहीं था आप क्या बोल रहे हो. And you never told me this could happen. So try to tell them everything, even the same story. कि आप एक्सीडेंट जा रहे हो, there is a possibility of the accident. That does not mean you are not going out. आपको रोड पे RTA हो सकता है, फिर भी आप रोड पे जा रहे हो. So this is the possibility. Thank you very much. Even though I did. And should the orthopedic surgeon refer the patient for an alternative opinion? These 2 things, if we can adopt any point of time, that may also act as a legal document. If you had somewhere mentioned whatever you were thinking, you should not operate this patient, or after that you can take the advice or second opinion. Always take a second opinion. Even maybe your friend or maybe your enemy, it doesn't matter, but always take a second opinion whenever you are in doubt, and that is also act as a legal document. So what are the recommendations? After this boring lecture, include all the complications that may have a significant effect on the outcome and explain what treatment may be necessary. Try to avoid being told that I didn't understand. Patient usually says, Doctor, oh, मैं बांग्ला बोल रहा था कि आपने जो बोला था वो तो हमने साइंस से किया था, मेरे तो समझ में आया नहीं था आप क्या बोल रहे हो. And you never told me this could happen. So try to tell them everything, even the same story. कि आप एक्सीडेंट जा रहे हो, there is a possibility of the accident. That does not mean you are not going out. आपको रोड पे RTA हो सकता है, फिर भी आप रोड पे जा रहे हो. So this is the possibility. Thank you very much. How we should proceed? There are so many problems we are facing, but none of us know how.
I believe that all arthroplasty should be done in hospitals which have ICUs. This is, I think, the consumer court ruling. And secondly, there is a ruling against one of the most senior orthopedic surgeons in India, in which unfortunately a case got infected. I think all of us are probably aware of that. So these are very fearful thoughts which come to your mind. And I tell you that case, Mr. Basu, actually you will regret operating him because the courts, you have to go all through the things. So this is the time when we have to be very, very
there are so many Mr. Basus which we are going to face in future, because nowadays they don't accept.
A lot of relatives will come over, they will create a lot of trouble. And there is a very big mental stress on the surgeon. We are not mentally tuned, we are not geared for that kind of behavior that really takes a big toll on your health and happiness. So let us be very careful. And you see, I don't know, in Cawnpore there's an ad of a young girl sitting cross-legged. I mean, good-looking girl sitting cross-legged for arthroplasty. And it's all over the roads. I mean, I've not put it, you've not put it, but people expect that kind of thing.
Yes, that is very true. That is very true.
I mean, and seeing an urge to get more patients, we tend to sugarcoat that bitter pill a bit less. And that's a fact all of us know it.
No, there is a regulation of the MCI. Now our chairman, Dr. Devi Sethi, he is very close to the MCI. Now he restricted us. We cannot say anything even over the poster, over the hoardings, maybe in the papers, which will allow the patient to come to your hospital. You cannot dictate anything directly, which is going to prompt to bring the patient to your hospital. You cannot say that I am doing this very unique way. This is what you are saying, that is very false, that somebody showed that somebody is cross-legged sitting and the patient's expectation will be the same.
We are suffering because of that, but really, in fact,
you know, this is always written. Now we are practicing that also. There is a one software there in our hospital. What we used to say, we used to keep it on. And whatever we are discussing, that is going to record.
Have you informed the patient that you are recording?
No, not
No,
yet.
see, that is a legal offense. Any recording cannot be done without the consent. And once you start doing it, the patient starts become very, very. हमारी recording हो रही है, हमसे बात करेंगे तो क्या कर? You know, I mean, these patients are not used to those things.
This is not our education only. This is the education to the patient also. But
But the downside of video recording is that in the conversation you can say that I told and he didn't understand. But if in the downside is if it is recorded and you tell something, that is the point where the good
It's a catch-22 situation, sir. See, once the patient goes to court, most of the time things are loaded against us. When infection can be a cause of, a reason for giving a verdict against a surgeon. I mean, we are in troubled times ahead.
And the most important for the young surgeon, like you must take the medico-social history of that patient, their attendants, because once the complication happens, like if it is he is the advocate or he is a nuisance, then I think you have to refer that patient to the senior person or in the other cities like that.
Sir, most of the time,
you can refer that patient to Delhi or Mumbai or something else because in your town they will be big nuisance.
Sir, वकील बताते नहीं हैं पहले. Sir, they are very smart. They will come to you. They will not tell. And once,
in a conference anyway, we are discussing it because it's an informal. Yeah, it's a priming. But yes, friends, that's important thing. Joint replacement is a serious business. And again, I'll quote another professor, CCJR. There's a slide. If you cut them, you marry them. Remember that. Because the joint replacement, in trauma there's so much of, you can get away with a lot of things. But in joint replacement, you have not done well. It's like marrying a person who is going to crib and make your life well. So you have to really perform well. And divorces are never, ever known to be good in our setup. So remember that our surgery should not land where you have married the patient and you're going to get divorced. Yeah. The alimony is no guarantee.
And thank you, Dr. Singh. Okay, thank you very much.
One more, sir. Yeah, Dr. Rajesh Tripathi from Jhansi.
It's very good lecture about the agreement. I just want to add one thing. What I am doing for last 10 years, the consent we say to the patient, the consent we write on a BST, the consent goes to along the patient on discharge. मैं गिर गया हूँ, मेरा पैर टूट गया है, इस पैर को जोड़ने में 2 से 3 माह लगेंगे, इसके कॉम्प्लिकेशन, मवाद आना, इम्प्लांट टूट जाना, लिम्ब आना, ये मैंने अपनी मातृभाषा में मुझको बता दिया गया है। अदरवाइज व्हाट यू से इफ यू आर बंगाली, अब ऐसे इन हिंदी यूज से कि साहब इनने जो पका हमने नहीं सुना। मैंने अपनी मातृभाषा में समझते हुए सहमति प्रदान करता हूँ। This we should write it, and I have won 2 cases because of this consent written on the discharge paper. वकील साहब ने खुद ही कह दी कि इसमें केस हो नहीं सकता, इसमें लिखा हुआ है कि मवाद आ सकता है और तुमको लंगड़ाई आ सकती है, लिखा हुआ है, कैसे केस हो जाएगा। So this thing we should practice and give it in their paper. उसमें लिखा था मैंने डिस्चार्ज पेपर प्राप्त किया, and we should do it and see the half of the case will reduce to your problem.
Nowadays, what my hospital is practicing, if you are going to do any surgery or if you are going to perform any procedure, there must be signature of yourself, not your junior. They are not going to take the patient until unless you met the patient party outside the theater, and you have to sign whatever you want to write. You have to write and you have to sign. Until unless you are going to do that, ward boy is not going to push your trolley inside the theater. This is very well, they are doing that.
The mother thing is very important.
Couple of them came. The idea was Pankaj Tandon, the another idea given was Dr. K.T. Tripathi. This time we have focused on younger crowd. He can see that, and this is what he told me. It was इस बार हम लोग को यंग लोगों को करना है क्योंकि वो लोग सर्जरी तो कर रहे हैं लेकिन अभी उसके बारे में ज़्यादा समझा नहीं। They should know it's a serious business, and we have focused on younger population. Sure. Vijay, both.
Thanks. I heard all what you taught. I take all your points, but it's very loaded against the patient. The patients are all not bad. First thing is that. Now I do a lot of American patients. So far I've done about 901 page, and he said, "This is all the consent form I'm going to sign." Usually I sign 10 pages, 20 pages back home. Then the hospital wanted to do the same thing in Chennai. I said, "No, we cannot bring that bad practices to our country." So our country, a lot of things are on trust. And if the patient wants to sue you, no matter how long you take your consent, they will sue you. Remember that. So a lot of things goes on trust. Don't forget that. What trust you have in the patient. And go on expanding to 2 pages, 3 pages, 4 pages, 5 pages, but you're never going to win this game. So that's not the answer. The answer is not having a 20-page consent form. I do take all your points, but you must be more careful. The trust, I think, also plays. And our country, we are known for that. Our patient-doctor relationship has been very sacred, and it's been like that for a long time. We should not lose that going down this route, just to balance the argument, because they are one-sided. And we should portray all patients, coming to sue us, not all. So, just to balance the argument, I want to give the other side.
But Dr. Bose, I must say that this is not true for every part of the country.
No, that's not true.
Let us not say that. No,
that's why I said the philosophical statement, because when you cut them, you marry them. That thought process has to be there for every patient. You are marrying a lot of patients every day. So just remember, the relationship has to be built upon that. They want something to be delivered. Are you capable of delivering them? If you are not capable, please become capable of delivering the desired level. Otherwise, don't do it. So that trust has to be there. And then only the relationship blossoms.
Thank you. Okay, thank you very much.
So now we are coming to the end of the common session. Actually, there is another lecture by Dr. Anil Arora, but he is late. So we are starting with the hip session. And our show starter for hip session, Dr. Vijay Bose. Please come on this.